Welcome everyone to June the 2nd's media advisory to what has been a rather spectacular, windy, warm day and a great weekend. I'd like to start off by wishing everyone in our community celebrating a very happy Pride Month. Now more than ever, we need to continue meaningful dialogue to ensure all people in the queer and trans communities in Hamilton feel respected, supported, celebrated, and safe. I encourage all citizens to support and celebrate our queer and trans individuals and the community they bring to our city by engaging in the virtual programs that are available. So you can visit pridehamilton.com to learn more all about that. In addition to June being Pride Month, there are also additional causes dedicated to the month, including the National Indigenous History Month, ALS Awareness Month, Seniors Month, Italian Heritage Month, and many others that I will be acknowledging over the next few weeks through our sign and through our tweets and posts. Equally, Black Lives Matter protests is certainly worthy of discussion today, and businesses and individuals are acknowledging Blackout Tuesday on social media in solidarity with Black Lives Matter's movement. Every single person in Hamilton, no matter who you love, no matter what faith you practice, no matter your skin color or where you come from, deserves to live and prosper in a safe and caring community. And I've said it before, and I'll continue to say that there is no room for racism in Hamilton, no room for intolerance, no room for hate. In our country and in our world, and an attack against any one of us is an attack against us all. And I think that level of solidarity we need to maintain as a community, as a society, as a country. Speaking of country, the federal government just yesterday announced that they're doing an advanced transfer to municipalities of some $2.2 billion in gas tax revenue to cover some of the COVID-19 budget shortfalls. I would say that it's a welcome advance of monies that have already been announced, in fact. So it's not a long-term solution, but it's certainly a short-term assist in terms of our cash flow issues. But this is money that was already baked into the budget, so it's not new money, money already budgeted for on projects that we're already planning on doing. And so I would continue to ask our federal and provincial partners to look for ways of having dialogue with municipalities on more help and assistance that will provide a better benefit, not only in terms of supporting the local economy, but helping us with the deficit issue that we're going to be facing in 2021. And if they do that, it's going to help us keep frontline services going. It's going to preserve our municipal services that most of our people depend on. And it's going to be going to put us in a position to be ready to be part of Canada's recovery when and if our economy starts to get back into some sense of normalcy down the road, which it will. We are going to get through this together collectively. We are going to get to a better place, and I'm sure that we will find a way of managing and minimizing the risk of this virus as long as it exists and cohabitate in a way that continues to support our economy in due time. The province also announced that they're extending their emergency order until June the 30th, which is not a great surprise. I think they're extending this on a 2-week period basis. And as they've said previously, they were going to move forward cautiously on openings. And that means that because of that emergency order, there's still a ban on gatherings of larger groups than 5 people, largely members of your own family. It also means that businesses remain closed, including restaurants and bars, except for takeout or delivery. The province does plan to reopen in Ontario in 3 different stages, and we are at stage 1. So we've got a ways to go. And we do need to see a consistent decline in new cases in the virus in order to continue to lift some of the public health restrictions that are preventing us from getting to the next stages. And as the Premier indicated, it's not going to be universal across the province. And so areas where there is not very much of a COVID impact will likely open up a little sooner. And areas like Hamilton, Toronto, Ottawa, London, high density communities that have greater incidence of COVID-19 will likely take a little bit longer to start to open up. And I think that is a reasonable assessment on behalf of the Premier, totally guided by the impacts of the virus in our community. The province also announced that they're going to maintain the fixed price electricity cost that on the lower end, which is the peak price, is not going to apply here. And they're going to keep that in place until October the 31st, which is quite an extension. So you're going to get the on peak pricing that is going to benefit everyone in terms of paying their hydro bills as more people are staying at home and doing more activities at home, obviously using more electricity at home. That lower pricing certainly helps offset some additional costs that they won't have to bear. In terms of city updates, I'm sure many of you saw the Premier's comments yesterday about reopening GTHA, Hamilton Burlington area more slowly that I just talked about. We're not clear, though, on what the metrics they're going to use to determine this, nor do we have any other details at this time. So we'll await for further details from the province about that regional approach that they previously talked about. I also want to talk a little bit about summer 22 is going to be quite different than we've seen before, and unfortunately, the city has made the decision to cancel all city-run summer programming and all summer Camp Kidaka programs, as well as the usual free summer SUPI programs. However, there are a number of recreation opportunities still available for families to participate in this summer. So as of today, you can take part in a number of virtual programs, including Rec at Home, virtual programming through Early On Childhood and Family Centers, and the Hamilton Public Library Virtual Branch, and the Senior Center Without Walls. All of those programs are virtually available to you as well to utilize over the summer. As well, we have a number of new activities that will be starting up later this summer once we confirm the logistics required to deliver them and the provincial orders related to these gatherings are lifted. So visit hamilton.ca/reopens for information on all these programming options. Good news on the stairs side that many people have asked about on an ongoing basis, including the media. Crews will begin reopening the escarpment stairs this Friday. So you can assume that they're going to start opening them on Friday, so they may not be ready on Friday at 7 a.m. when many people are wanting to do their workout, but hopefully later on in the day, they will start reopening and be available to you beyond that time frame. So if I were you, I'd probably wait till Saturday or Sunday and Monday or Tuesday, whenever you're planning a workout after Friday, to ensure that all the stairs are open. And a reminder that this still requires physical distancing along the stairs. And group gatherings are not allowed, anything greater than 5, hopefully of the same family. And we certainly encourage you to wash your hands before and after using the stairs. And I know many people like to use them as a workout. Some people use them as transportation. Clearly, it's an important issue to make sure that you maintain some physical distancing. And if they get too crowded, don't go. Go somewhere else. Physical distancing is still important. It's a bit more challenging to do on the stairs, and that's why it's taken a little longer to get them opened up. I think our medical officer of health deems them to be okay as long as people manage them the right way. That certainly includes potentially wearing a mask if that's more comfortable for you, but making sure that you wash before and after your hands as is always recommended. A reminder that the city parks and some park amenities are open for use within public health guidelines like physical distancing and not gathering in groups of 5 or more. Sports fields can be used for passive use by families in small groups of 5 people or less who are physically distancing. No organized sports activities, teams are practicing. So no pickup games of basketball or football or baseball, no organized leagues, unfortunately. I hate to go through the list of no's, but the bottom line is that you can use the parks passively with limited amount of people of less than 5 for you to enjoy in that capacity, but not in other ways. Park benches may also be used, and decorative fountains are opening this week as well. So the Gore Park fountain and the Gage Park fountain and other fountains that we have City Hall fountain will start to be turned on, and hopefully will make our city look a little bit normal. So a normal summer kind of look with a different kind of summer feel to it in terms of use and physical distancing that still applies. Spray pads, drinking fountains, and playgrounds are still closed at this point, and no new information at this point as to when they might open down the road. Stay tuned, and we'll certainly give you more information as it happens. I'm going to turn it over to our Emergency Operations Center Manager, Paul Johnson, for any additional EOC updates that he's prepared to provide. Paul?
Thank you very much, Mr. Mayor. And yeah, as you can tell from some of the updates that the mayor provided, we continue to monitor all the things that are going on in our city. And when we can take action to start up some new activities in the community, we do. A few things today. The mayor mentioned about, the amenities, including sports fields and parks available for families to use, for people to, throw a ball amongst a couple of people. Yes, we have actually already been informed that some teams are choosing to gather on fields and actually play a game. We had a baseball team that got onto the field. Unfortunately, we weren't able to get there with enforcement before they left. But do want to remind people that you are not to gather on a field and have a practice and just sort of hop the fence and I hope nobody notices. This is something we can enforce under the order. This is meant for people to enjoy just as individuals, not as teams. So I want to really reinforce what the mayor said because we have actually had over the course of the weekend a complaint that came into the community of a team that got together and were actually quite brazen about it, wearing something that clearly identified they were a team gathering together. So I know teams, soccer teams, baseball teams that would be well into their training and their activities already want to get out and want to do that. But this is for everybody's safety and so that the proper guidelines can be drawn up before those types of things return, whenever that is. A couple of things that we're reminding businesses, and in particular, people that have facilities that are starting to open up. Uh, Reminding that they may have been closed for a while and this may have impact on your water systems. And we have placed on our website at the hamilton.ca /coronavirus website some tips for people about your water systems so that you can make sure that they get up and running properly and safely. It is your responsibility to make sure that your water system is safe for those who will be utilizing your buildings. And it's a rarity. Anybody who owns a second home maybe understands the things that happen when you need to restart. We don't normally shut down buildings for this duration. And so important that people learn about the things that may be required, including flushing out the systems and making sure that everything is the way it should be. So from our Hamilton Water folks, an encouragement to head to our website, very quick checklists, easy to follow things that you should do as building owners or operators to ensure that anything that has been shut down for a considerable period of time is brought back online safely. And certainly as things begin to come online, we have some retail open today. Things will happen over the next weeks and months, and we want to make sure everything is done safely. Have had a few complaints come in about long grass. I do want to remind the community that we are not at full capacity for grass cutting. We were delayed and are behind in terms of bringing on some of the students that we normally have. We're at about 50% of the capacity of the staff that we would need to do the full-on cutting. And so, as we mentioned a number of weeks ago, we are prioritizing the major space within the parks, making sure that that's cut down so people can again get out and enjoy walking the parks. But there may be trimming in particular along fence lines and things like that that is not being done. That's not an error by the crews that are out there. That is by design. We're having to prioritize where we put our grass cutting efforts right now. And once we get back to full staffing complements, we'll certainly try and get back and do the job that normally you would see. But these are generally not in areas where people are participating in activities. Hopefully, it doesn't impact people too much. We are trying to keep the grass down where it is most used by the public, but there will be areas where you'll see long grass, us not doing the normal level of cutting. And we continue to see some good adherence to most of the regulations and the guidance that's being provided as more and more things become open for use. We're going to have signage generally in the area, but we're asking people to just remember the things that you should always be doing, because there may be certain things that open. We've had questions about will there be specific signs on the Hamilton sign downtown out front of City Hall, because people might go there and touch it. So should there be a big sign that says, keep safe and do this? And our answer to that is we can't sign everything. So, generally in areas we have signage that reminds people about physical distancing. On our stairs, we will have specific signs that remind people to wash their hands before and after using them, as the mayor mentioned. But we're asking people wherever you go, whether it's a city location in a public place, or whether it's a private place of business or your own home, that you're taking those very simple and straightforward public health messages that haven't changed much. The addition that's come in the last number of weeks, of course, is using a mask, a non-medical mask in the public. But the public health, hygiene, and physical distancing stuff has been there since the very beginning, and encouraging people to always be doing that, even if you maybe don't see a specific sign right beside the place where you are. It's not something that should ever be deviated from at this point where we are. So I'll turn things over now to Dr. Richardson.
Great, thanks, Paul. And as you said, it's been the message from the beginning, and it continues to be the message. And I'll say it a couple of times more just now. So from a case count perspective, we stand at 697 cases as of 9 o'clock this morning, 690 lab confirmed, 7 probable. That's 12 new cases from yesterday. And that's another reminder, we're consistently seeing about 10, 12 cases many of the last days of the week. Many of the last days of last week. And so just reminds us that we are still having ongoing transmission, and we really do want to see those numbers continue to come down at into below 10, below 5 sort of range, ideally. Of course, eliminating it would be even better, but for sure, bringing it down below the 10 mark. The good news, though, is that we now have 529 or 76% of our cases resolved, which means we've gotten back up into the 70s. That's really great. There have been 38 deaths to date, with no new deaths today. We're down to 3 institutional outbreaks, one at the Hamilton General Hospital in the COVID-19 unit, as you're aware of, one at Aberdeen Gardens retirement residence, and one at Desmond and Peggy Little retirement residences. With 2 of our outbreaks that had been in place being declared over as of yesterday. Those were the ones at Macassan Alexander Place. So this is the first time that we've been down to this few outbreaks in a very long time. And so very encouraging on that front as the number of outbreaks steadily decrease, with all the testing that was done, the work that everybody is doing in those long-term care homes, the visits that are being made to ensure that IPAC is well used, and that people are doing the distancing and the screening that needs to be done is really paying off and making a difference. And as well as I said, that 76%. So really good news. But as we open back up, we want to make sure that everybody is really operating in that new reality, that we're remaining vigilant, continuing to follow all of the precautions. As Paul said, we don't need a sign. We've been training for this now for about 3 months in terms of what to do as a community. We have done exceptionally well as a community, and we just need to remember not to get tired as we go forward, or to think, oh, it's not a big deal. Nobody I know has really gotten that sick. No, there may not be somebody that you know directly, but there has certainly been plenty of people who've gotten sick, very sick. And in fact, of course, we have had deaths related to this virus. And we're trying to continue to protect ourselves, the vulnerable people who live around us, those who live in long-term care institutions, retirement homes, people with chronic illnesses, so that they can stay well throughout this, and ultimately for all of us, because we've seen those situations in countries where the numbers have gotten out of hand, and where the health systems become overwhelmed, and we don't have the resources to care for people, and we certainly do not want to go there. So we can't let that pendulum swing too far in the opposite direction, but to carefully move forward, continue to do the appropriate distancing. I'd say, so you might say, especially for those who are in that sort of 19, maybe a little younger, 16 to 25, 30-year-old age group. We often find that's an age group who are a little bit more comfortable with risk and taking risks, and they're a little healthier. And so they tend to perhaps think that they're a little more immune to the issues that we're talking about. And so we'd really encourage them, just like all of us, to make sure that they're following the rules, because we do know that this can happen. Severe disease can happen in anybody of any age, and particularly so those of any age who have medical conditions, and the elderly. So please, while you may be feeling very healthy, we all need to do our part to protect not only ourselves, but to protect each other. The other piece is about masking in relation to that. And so if you're out and about and are in places where you are going to be unable to maintain that physical distancing, do remember to take a face covering with you, to wear your mask, to be careful how you put it on and take it off, wash them in between, and just do those basic things like washing your hands with soap and water, covering your mouth, staying home if you're at all sick. So that's about it from me, Mr. Mayor. So I turn it back to you.
That's great. Thank you, Doctor and Paul. And I'd like to give another quick shout out to the organizations that are doing great things above and beyond our community relative to the coronavirus pandemic. A shout out to our Hamilton Public Health Library. They have started a friendly calling program to reach out to seniors who are library users and may be feeling isolated during this pandemic. Since April, they've phoned about 6,500 clients aged 75 and up to say hello, also to lend tech support so they can easily access the library's many online services. Thank you to Paul Takala, our chief librarian, and Erica Connolly, the library's manager of adult programming, and the entire Hamilton Public Library team for that great initiative. And a shout out to members of the Hamilton's Donichi Social Club. They're sewing cloth face masks for the YWCA and recently donated their first 50 masks. They started a campaign called hashtag So Grateful YWCA Hamilton to encourage others to help out. So for more information, visit the Donichi Social Club page on Facebook. Congratulations to Valentina Spadafora and Mauricia Morella for this wonderful effort. And So Grateful is spelled, as you might guess, SEW Grateful YWCA Hamilton. Great initiative, great effort, and lots of people chipping in various different ways to help one another in our community. 6,500 seniors been connected to by the library. That's amazing. Great job, Paul Takala. Going to go to Jasmine right now to take any media questions.
Thank you, Mr. Mayor. We do have a number of media partners on the phone with us today. We'll start with Samantha Craigs from CBC Hamilton. Samantha, you can go ahead.
Hi there. My question is for Dr. Richardson. Do we have goals in terms of testing, and are we meeting them right now?
Hey, Sam, in terms of testing, the strategy for testing is now being put together by Ontario Health. And so there are those three arms that we've talked about, the outbreak related testing, the assessment center related testing, and then the testing of other vulnerable populations or population groups, the targeted testing. And so we do know that overall we have a goal of doing about 20,000 tests per day and ramping those up to 50,000 to 100,000 over time. And so, as a whole in the province, we haven't been given specific goals here. And in fact, the development of the more detailed strategy around the targeted populations in particular, but also supporting some of the testing in long-term care and whatnot is being coordinated by Ontario Health. So probably best to go to them to get more details at this point.
Mm-hmm. Are you happy with the level of testing that we're doing right now, or would you like to see it increase?
Well, we certainly know that testing has to continue to be the backbone of our response, along with contact tracing. So that's really important. Along with that are the other factors that you heard us talk about in a presentation last week. Thinking about things about how we can support people who come forward for testing and support them in continuing to isolate themselves, to get tested within 24 hours of symptoms. We're starting to track the data in terms of how fast people get seen in terms of how soon after symptoms start. So as we start to track that more closely, really want to see that number rise up, in the 70s, 80s. I think right now it's sitting in the 40s. What's the first preliminary number that we pulled off? Really want to see as well in terms of our continued capacity to respond that we have our contacts and cases are clear, and we're able to do that. Our health systems capacity is really, and so we do know for our health systems partners, our hospitals, that their occupancy is climbing with their inability to transfer people back to long-term care and those sorts of issues. So we absolutely want testing to go up and to continue to rise, but there's a lot of other factors we need to look at as well.
Thank you.
Thanks, Dr. Richardson. Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks for taking my question today. My first question is about long-term care homes. The opposition is calling for transparency on what homes are in the red, yellow, or green categories. And I'm looking to find out if the public health has that information and if you will make it public, and why or why not.
Sorry, Joanna, I didn't hear your question. It cut out.
Oh, sorry about that. The opposition is calling for transparency around what long-term care homes are in the red, yellow, and green categories. So I'm looking to find out if the city has that information and if you will release it and why or why not.
So at this phase, what we do is contribute to that assessment of red, yellow, green. So it's really an assessment that's done by public health, by the Retirement Home Regulatory Authority, by the Ministry of Long-Term Care inspectors. And so all of that data is given into the ministry, and then they finalize the ratings once they've gathered their information from different spots. So the final rating we don't have until after all of that data goes in. So Ontario Health is really the best person to get the most up-to-date data from, and the group that's pulling that together. In terms of where we're at, we talk about that regularly in terms of our orders and the pieces that we play, but really Ontario Health's the best person to get that from. And, we can talk more with them about that and find out where that's at in terms of being publicly available.
And my second question, thanks. My second question is there are now 10 workers that are infected on a unit that cares for COVID-19 patients. It is the second time that workers have been infected on COVID-19 units. Is there more that should be being done to protect these workers? Like, are you looking into why this is happening and spreading on these particular units?
So in terms of those hospital units, the responsibility for reviewing that actually lies with the hospitals. And so those are clearly occupational health and safety concerns, and they do have their own infection prevention control teams that do all that work, would look at any cases at any outbreaks. We certainly, get the cases, follow up, and contribute where possible in terms of things to add. What we do want to make sure happens very closely is that people do wear their infection prevention control equipment, of course, when they're looking after patients. I think what we have seen sometimes is that as people come away from those scenarios, when they're intensely providing patient care, the hospitals do a really good job in making sure that somebody's watching to see how people take their equipment on and off on a regular basis, so that that's where it can be tricky in terms of potentially contaminating yourself. But the other is just as you're going to and from work, as you're taking a break, as you're going out, is to remember all the times what you need to do. So best people to talk to about what's actually their experience in those and what they're doing about them as they go forward is the hospitals. But that's mostly what we're seeing in terms of challenges there.
Thanks, Dr. Richardson. Next question will be to Tevia from the Hamilton Spectator. Tevia, you can go ahead.
Thanks very much. Thanks for taking my question. Dr. Richardson, I'd just like to ask if public health has any concerns about some of the large, pretty big protests that we've been seeing recently. Obviously, people have a right to protest and protest about the George Floyd-related tragedy in the United States. But I would have to say that at Gore Park the other day, certainly the organizers made an effort to try and space people out, and were handing out masks and offering hand sanitizer. But at some point, it was pretty crowded in there. There are lots of people that didn't have masks, for instance. Are you concerned that this could be a bit of a public health that the virus could potentially be spreading because of this?
Yeah, it's a good question, Tevia. It's such a difficult situation. Of course, we all have the right to protest, and of course, these are issues that are going to bring forth a lot of passion, a lot of concern, and people are going to want to express that. It is a time though when we have to be careful how we do those things, and so following through on that advice is important. Thank goodness the rates are low in terms of the number of cases that we're experiencing, but those are the kind of situations where you can get people more densely together. You can also get a lot of yelling and loud voices and talking, which we know increases the rate at which the virus is expelled from anybody who might actually be carrying that virus. So yeah, they are circumstances of concern, and as much as possible, we would want people to be wearing masks, to be distancing, to do everything they could to reduce spread in those circumstances.
Right. Is there any sort of follow-up that can be done in a situation like this? Or is it just a little too difficult to begin to trace people, or is even a cause or a reason to trace people at this point.
No, yeah, there wouldn't be a reason to trace anybody at this point. I mean, if we became concerned because we had a number of cases and they said that this is what they had been doing, then it would be something that we would follow up on from that perspective. But at this point, no, there's none. The reminders that these following these measures are very important is about all we would do at this point. But again, it would be if we saw a reason to do anything further that we would do that.
Thanks.
Thanks, Dr. Richardson. Next question will be to Matt Ingram from CHCH. Matt, you can go ahead.
Thanks so much for taking my question. I wanted to ask you, Dr. Richardson, if you got down to 10 or under cases a day, what would your thoughts be on reopening sooner than other communities? Because I know Halton and Niagara and Toronto have obviously had a much harder time with this than Hamilton.
Thanks very much. Yeah, I mean, we've talked about the regional approach, and thankfully the Premier's been open to that and looking at doing things in a way that makes sense for particular areas. The cases coming under 10 is just one of the indicators for opening. It is the capacity for us to be able to do that case and contact tracing. It is our health system capacity to be able to respond in the case of any more severe cases. All of those factors, it's a whole range of factors that are important to monitor, and you're going to see more about that from us in the weeks as we go forward. So definitely would like to see those cases come down, but would also like to see those other factors and make sure that they're consistently lower. And we are so close to the Greater Toronto area. It's going to be one of those things as we move together, and yet understand where we might be able to make some changes if the Premier was willing to be a little quicker with those. But absolutely, those are going to be discussions that are held with the province.
Can you tell me a little bit about what some of those other factors and what else you would be looking for as someone, to perhaps advocate for a quicker reopening for the city of Hamilton?
So, these are the ones that I had mentioned. They're the number of outbreaks that we have. They're the number of cases that we have. They're the case and contact tracing, if we're able to do that within 24 hours. Ideally, we'd also like to see people getting their tests within 24 hours of being symptomatic. We want to look at the number of community acquired, as we call them, cases. We will know, because that's an indicator of us not being able to follow up people in a quick enough time, and so the virus is spreading too quickly. It is those hospital, do they have enough beds, enough ICU beds, enough ventilators are really key as well. So all of those are key indicators for us. And, in terms of us, really setting some thresholds, and as we move forward, I think that's what we're going to explore. The province is looking at that right now, as we know, and it'll be an ongoing dialogue. I think, really what the Premier has been really clear about is that they'll make the decisions about opening things up and relaxing the orders, and it will be more an issue for medical officers and regionally about whether or not they feel comfortable with moving in that direction. But absolutely, we can advocate either way, depending on the numbers.
Thanks, Dr. Richardson. We have some time left, so we'll go through the list of reporters one more time if anyone has any additional questions. Samantha, we'll start with you if you'd like to ask any other questions.
Yeah, my question for Dr. Richardson again. You were talking about how many new cases we had and that you'd like to see it under 5. And I know that we have had days where we were under 10. Are you worried at all that we might be creeping back up again in the wrong direction?
I wouldn't say worried yet, Sam. I'm just aware any day that we're starting to see 12 cases, and we've had a couple of those, that to keep an eye on it and see which way it's going. Really, as I said, would like to see those numbers come down, and it's a matter of watchful waiting at this point.
Thank you.
So we'll move to Joanna. Joanna, if you have an additional question you'd like to ask.
Thank you very much. I wanted to do a check-in on the Roslyn, whether the Roslyn has met the orders that the city has put in place. I know there's also ones with the Retirement Home Regulatory Agency, but I'm looking to see when it comes to what the city is looking to see from the Roslyn, if they have met whatever they need to do to open again.
Sure. Thanks, Joanna. The Roslyn, there's now 2 outstanding public health orders, which I think you know. There's both the initial, like the Health Protection Promotion Act order around infection prevention and control, and those particular matters. And we had told the operator we wanted to inspect the home again prior to them accepting any residents. As of earlier today, the last time I heard from staff, they still had not heard from the operator that they wanted to schedule that inspection, that they wanted to do that. As well, when our inspectors went in to do a food premise inspection, so that's when they go in and look at the kitchen, the same sort of thing they do in every long-term care, every retirement home, every restaurant. They found there were significant concerns related to that inspection as well in terms of infestations. And so they wrote an additional order to have them clean those up. And I don't believe we've re-inspected around that item either at this point. So both of those orders remain outstanding. Of course, even once they begin to, if they got to the point of having people come back in, we will be closely monitoring, because we can't really see how you're doing your infection prevention control practices. I mean, we can make sure there's enough supplies, we can make sure that everything's clean, we can make sure things are appropriately distanced, but we can't see it how it's actually working until people are there. And so we'll be doing some close monitoring inspections afterwards if they do end up bringing people back into the home.
Thanks, Dr. Richardson. Tevia, we'll go to you next for another question if you'd like.
Sure. Thanks, Jasmine. Dr. Richardson, maybe I'll just ask as a follow-up, if you could, if people wanted any sort of advice, if they're thinking about organizing a protest, we might see more for sure. Is there anything they should do? Should they contact public health, or do you have any specific advice?
I think Paul said it really well throughout, which is that, we've given the advice remains the same. Physical distancing is so key. Not gathering in larger groups is very key. Mask wearing is key, or washing hands, all those sorts of things. So that's really tough if you want to protest in that sort of way. I guess the question would be, are there other ways to express those feelings, other ways to protest what has gone on, which wouldn't involve coming together in a physical mass gathering, but might be other ways to do that.
Thank you.
Thanks, Dr. Richardson. We'll do one more question to Matt from CH. Matt, if you'd like to go ahead, you're welcome to.
Thanks very much, Jasmine. Yeah, I was wondering, actually, Mr. Mayor, if I could get your opinion on this. I asked Dr. Richardson about what she would like to see in terms of thresholds and numbers for, being an advocate perhaps for reopening the city a bit sooner than other areas. I remember when a few weeks ago when we spoke, I asked you about opening Hamilton up a little bit sooner, and you had some concerns about people coming from Toronto and other areas. I was wondering if anything had changed for you. We've still done much better than some of our surrounding partners, and what would you need to see in order to be more? I know it's up to the Premier to ultimately make the decision, but what do you need to see to be more of an advocate for reopening, or do you dismiss that idea?
Well, I don't disagree with the Premier in terms of some of the larger centers where there are more cases than there would be in rural Ontario. Would be later in the list in terms of opening up. So as we're still seeing increased numbers of cases, and both Toronto, Hamilton, Ottawa, London, some of the bigger centers, and minimal amounts of cases, and in many places no cases at all. There'd be there's a logic to the notion that where there isn't any spread going on right now, maybe that's a place where they can start opening up a little sooner than some of the bigger centers where we're still seeing increases in cases. So I would say I don't disagree with that. All the Greater Toronto Hamilton mayors have agreed that we're going to be guided by public health recommendations. So notwithstanding my opinion politically, I'm probably like most people. I would like to see us open everything up in a perfect world, because it would feel better and more normal. And our economy would get reestablished. But the reality is that there are health impacts to that I don't think are acceptable. And so I'm completely in line with what our medical officers of health are indicating. And until such time as we are seeing a significant decline in the number of daily cases, then we should be measured by how that's moving forward and whether or not we're going to continue to have new cases. When we see events like a group gathering in Gore Park with people not necessarily taking the appropriate precautions and gathering in numbers greater than 5. Those are areas of concern, and there's a latent effect of that potentially you could imagine, for all the protests that we're seeing now in the United States, that two or 3 weeks from now, we might see a spike in the number of cases that are going to occur here. And so that may very well cause them to have a setback, and could very well happen the same here in Hamilton. So I'm pretty comfortable with the direction that our public health is providing for us. I think a slow and steady approach is the way the Premier is moving forward, and the way, in fact, the country is moving forward. And I have no argument against that.
Thank you, Mr. Mayor. So I think that's the end of our media questions for today. We'll pass it back to you for some closing remarks.
Okay, thank you, Jasmine, and thank you to the media for those questions. And I'd like to spend just a little moment talking about the expectations for the summer events and maybe even the fall events. I think I've mentioned in the media a couple of times, this summer is not going to be the kind of summer that we would have all have expected normally, where everything is open, all the pools are open, all the major events that normally would occur, Peach Festival, beer fests, you name it, are likely not to happen this year. And I think some of the organizers of the events heading into the summer and the fall might want to start thinking about how much time and effort they're going to be putting into, potentially organizing and preparing for events that may very well not be happening. The likelihood is pretty small, certainly for events that are happening in June and July. Clearly, we're still at a state of emergency, and that's just been extended to the middle of, or June the 10th, and may very well be extended another 2 weeks thereafter. And so, in the next couple of months, it's very unlikely that any major event of any size could be pulled together. So I would ask, some of the major event organizers to start thinking about, how much time and effort they're going to be putting into organizing these events, and how much resources they're going to be putting into that. And certainly, have those vendors that are participants in a lot of these events thinking about how much commitment they're going to make to participating in these events as well. I think the ultimate decision lies with the organizers, but you can certainly get some advice from our public health and our emergency operations team. Some have reached out to us and have asked for that, and already the Peach Festival in late August has decided that it's not in their interest to continue to organize this event, not likely to happen, and too much time and effort to be put into trying to organize something that the likelihood is, almost zero that it's going to be doable back at that date and time. So all I ask for is event organizers to start thinking about, their events and how they may fit, and how much time and effort you want to put into that. Lastly, I'd like to thank Rosalie Visers and Kim Peltier for their American Sign Language interpretation and efforts, and Bill Custers, of course, at Cable 14 for their effort to put these broadcasts together, and Maclean's Media for making sure that it runs as smoothly and as smooth as possible, as it always does. And of course, we continue to thank all of our essential workers out there in the broader community, working each and every day to keep our city functional. There's a long list, and I'm going to spare you that list today, but everybody that's out there that keeps the grocery stores going and keeps our city functional. Thank you for all the work that you're doing at risk each and every day. And a reminder, folks, that we're still in a state of emergency. So this is not, let's just everybody get back to some sense of normalcy. Unfortunately, we're not there. There is still risk in the community, and that risk needs to be mitigated. And you'll know that public health has said the best way for you to minimize that risk is to maintain that physical separation, wear a mask if in areas where there are more gatherings of people, wash your hands frequently, cough into your elbow, sterilize or clean surfaces that you're in regular contact with, and at the same time, get out and enjoy as much as you can enjoy in our community that is currently open. And I think that list we've gone through, a number of times today. So thank you all for tuning in, and a reminder that our virtual town halls will now take place on Thursdays, the last Thursday of the month, only once a month, with the next one coming on Thursday, June the 25th at 7 p.m. So hopefully we're narrowed the focus on the virtual town halls, maximize the impact and minimize the repetition. And so the virtual town hall will happen on June the 25th. You're welcome to tune in at 7 p.m. and it will be live streamed and broadcast on Cable 14 and other means of accessing that through the phone as well. Thank you all for tuning in, and we'll see you next coming Friday for our next virtual town hall. Media advisory, I should say.